Well, good evening, everyone, and welcome to tonight's webinar from the Western New South Wales Primary Health Network Digital Health Team, our first for the year of 2026 on the share by default reform, better and faster access to health information. I'd like to kick us off with just some quick housekeeping. So type in any questions you have into the chat box and we'll certainly address them at the end. I am joined this evening by my colleague Lisa Bowes on the panel, so she'll help moderate the chat at the end of the slides. Everyone is on mute and the session is being recorded and will be made available on demand through our website and our YouTube channel. And of course, at the end, please complete the evaluation form after the session. It'd be valuable as always, and there's a QR code you can scan to complete that survey. But of course, I'd like to start tonight's webinar by first acknowledging the traditional owners and custodians of the lands on which we all meet this evening. I'm on Wiradjuri land and I pay my respects to all First Nations people, recognising their continuing connection to land, water, culture and community. And I extend that respect and warmly welcome any Aboriginal and Torres Strait Islander Australians who are present here tonight or who may catch this recording at a later time. So thank you very much for joining us this evening. So our learning outcomes for tonight, and I'm on a mission to try and keep this very short to a 30-minute webinar, but hopefully describe what better and faster access to pathology and diagnostic imaging results means. Apply updated knowledge of share by default with my health record requirements, including which providers must comply, key exceptions and actions that prescribers need to take, and identify resources to guide patients in understanding their test results, and explain how patients can access and control who views their information in my health record. But look, I'm just going to quickly start as a formality for those that may not know. I'm going to take you through the basics on what my health record is, and then we'll quickly move into the share by default legislation. So my health record is a summary of an individual's key health information, personally controlled with key elements of the system, an online summary, and part of a national system, accessible at all times and protected by legislation, probably the most important. And the crux of tonight's webinar is going to look at that legislation and the amended act that reflects the share by default change. But the My Health Record is private and is protected via that legislation, and in this case, the My Health Records Act 2012. And it is secure through multiple layers of international best practice in ITC security. But look, I thought it would be wise just to throw one quick slide up here on some of the most recent statistics, and this was extracted, this is dated December 2025, and in particular, you know, who are using it. And I want to hone in, because tonight's presentation is going to be about diagnostic imaging and pathology, we can see quite an increase. And these statistics are sort of before the legislation has really started to kick off. December statistics will see a little bit of the pathology impact there with that increase of 93%. And more importantly, an increase of 730,000 records in the last year alone. So it's consistently growing year on year, and that volume is probably not going to dissipate. But this slideshow is a list of available documents in the My Health Record system. So real quick recap here. For healthcare provider documents, it's entered data, which are clinical documents such as health summaries, discharge summaries, and the like. And then there's also the Medicare sourced information, which includes your Medicare benefits and Department of Veteran Affairs item numbers, pharmaceutical benefit schemes, Australian Immunisation Register data, information recorded on the Australian Organ Donor Register, and My Medicare Info. And then there's the consumer-centred entered data, such as personal health summaries and advanced care planning documents. And lastly, we have the documents that are shared with My Health Record, like care and support plans, as well as My Medicare information. And then, of course, your overviews. I'm not going to talk through every single one of those, but I'm going to highlight the two that which are going to reflect tonight's webinar. And it's pathology reports overview and the diagnostic imaging reports overview. So the pathology allows healthcare providers to streamline their viewing of those reports. And overview sort the available tests within a specific date range. That filtering option is very, very handy to look at the most recent up front. And the same goes for your diagnostic imaging providers and their reports. So the benefits of using My Health Record. And this happens to be some testimonies from specialists in particular in the research that the Australian Digital Health Agency has undertaken with some of these testimonials. And viewing previous discharge summaries and medication records are accessed most often. And here are some benefits that are reported by specialist practices. So saving time requesting, being able to view information that was previously unknown and otherwise would not have been accessible, not needing to order pathology test by being able to see precious test results, not needing to order a diagnostic imaging test by being able to see the previous results, and saving time collating and communicating information to other providers. Now, as I said, access to My Health Record, we've got healthcare providers and we've got consumers. For healthcare providers, you have either conformance software and you have the national provider portal, but only the conformance software has an upload functionality. And then for consumer, we have the website through your MyGov account, and of course your mobile phone, which is now called 1-800-Medicare, is the latest update on that. And with the legislation, I'll go into a little bit more details about the modification or the amendment, sorry. As I said, it's protected by many layers, with everything layering up to the Australian Privacy Act 1988. So without further ado, let's get into the better and faster access. So on the 15th of February 2025, relevant provisions of the Health Legislation Amendment, or the Modernising My Health Record Sharing by Default Act 2025, or the amended Act of the My Health Record Act 2012 and the Health Insurance Act 1973. And the purpose of the amending Act is to establish a new legislative framework for requiring certain key health information to be shared with the My Health Record system. It's subject to certain exceptions, which we'll explore in a lot more detail in a second. But improving access to health information in My Health Record is at the heart of the recent reforms to Australia's digital health landscape. And look, historically, not all key health information was required to be uploaded, leaving gaps in a consumer's record that potentially hampered care. Now, the new sharing by default legislation aims to modernise healthcare and that sharing of information, delivering more timely. So we talk about real-time and comprehensive information for providers and consumers alike. Now, these changes actually respond to recommendations from the Strengthening Medicare Task Force report and were announced in May of 2023. And the Australian Parliament then passed the Health Legislation Amendment Act with the bill in 2024, setting out the new requirements for the providers. So there's a reason behind the description here of phase 1, pathology and diagnostic imaging. So for phase 1 of the reform, pathology and diagnostic imaging organisations are in scope of the new framework. So therefore, these health providers these are the health care providers, if you like, that are required to register and upload, right? And certain information and providing consumers with faster access. The requirements to share pathology and diagnostic imaging reports to My Health Record will help to bridge the information sharing gap by enabling the providers to view results that have been ordered by a member of a person's treating team. So remember, phase 1 also implies a phase 2 and so on will likely follow. Now, we don't know which health provider organisations will be in scope in future iterations, but it is important to stay across to some of the latest news coming out of the federal government in some of these reforms as we progress over the next few years. Interesting enough, though, that when the reform was announced, only half of pathology reports and a third of diagnostic imaging reports were being uploaded. So the hope is we get to a more real-time, regular, reliable source of information sharing. So what is better and faster access? Obviously, better, faster. It's a bit of a tagline, if you like, in respect to the legislation change, but better access, sharing by default, is healthcare providers, starting with those delivering pathology and diagnostic imaging services, will be required to upload reports by default. In future, other types of reports or documents may be included in the upload requirement. For faster access, pathology, most pathology results will be available for consumers to view in My Health Record or the app immediately after they are uploaded. Diagnostic imaging, So consumers can immediately view X-ray reports for limbs after upload. Other diagnostic imaging reports will be available after a 5-day delay. But better and faster access will support a better connected health system of information. So less duplication, greater efficiency, better informed decision making across teams, support the active management of health, and improve safety and outcomes. Now, definitely shouldn't go without saying, all of this reform is supported, as I mentioned before, from the work that the Strengthening Medicare Task Force report. But as this reform evolves and progresses, it all comes under the clinical reference group. So a committee set up by the Australian Digital Health Agency, known as the Clinical Reference Group, or CRG. And it was established, by the agency and the Department of Health, Disability and Ageing to provide strategic advice and clinical oversight to support the safe implementation of these reforms and future iterations. So it has 24 members, and you can actually scan that QR code if you like to get more of a detailed look at who are those members from relevant peak bodies and professional associations and consumer groups and the like. So it's very critical that the composition and membership of this group are at the forefront of the evolution of this reform. So this is the one page that I think summarises it neatly and aligns with the CRG recommendations. So from October 25, we went live with the no delay pathology results, and I'll show you a slide that talks about which pathology reports in particular. But anatomical, cytopathology, and genetic tests are still susceptible to a 5-day delay for patient access. Right about now, February, March, we then move into the diagnostic imaging. So X-ray extremities are no delay, and then the rest, your CT, MRI, PET, ultrasound, etc., retains goes from 7 to 5 days. So the no delay tests. Now I'll get Lisa to share a link to this download, a PDF download. So I'll leave this up for a little bit, but you can see here, in addition to those tests already immediately available for consumers to view, such as your HbA1cs, COVID-19 and other respiratory infection tests, most tests from each new category listed will also be available for immediate access. Now I've put a little note there which comes from the PDF download as well, with certain tests, including the combination of all three referenced there. But of course, as part of this change, there's a lot of patient education, and patients have access to an online resource via My Health Records, the web, and the 1-800 Medicare mobile app. There's a link to pathology tests explained, and so guidance support from how to interpret reports that come through. So to further elaborate on the better access is, as I said, a legislative change specifying the sharing of information to My Health Record by default. But providers will be required to register and use conformance software. So the framework is all about saying, well, as a pathology organisation responsible for fulfilling tests, and also for diagnostic imaging providers, you're now required to register. So you get your HPIO, all that kind of stuff, but also have the system, the conformance, to be able to upload those reports by default with no delays. A lot of system requirements to comply as well. So that QR link there is available for pathology and diagnostic imaging providers to get some support on how to undertake that registration support. But the impacted providers must share, right? So this legislation doesn't apply to clinicians ordering tests. This legislation only applies to pathology and diagnostic providers to upload. Now, I'll talk about exceptions and extensions in a second, but the impacted providers, when they're sharing, there has to be an exception and an extension, and more importantly, they have to, under the Act, under Section 78C, I think, to be precise, also requires in the uploading of the information must keep records on any evidence of exceptions and must be retained for 2 years. So it's very important that when GPs, for example, are putting in an exception that they provide that reason on the electronic order or e-request or request for a test, for example. So exception to My Health Record. Let's go into the details. So under legislation, there are certain circumstances, as I said, and there's 4 categories. Number 1, quite obvious, a patient does not have a My Health Record, so the legislation doesn't apply. A patient requests or a patient's authorised or nominated representative requests that health information is not shared to their record. So that's that checking the opt-out checkbox on the order, for example. The third category here is probably the most important and clinically relevant. So a healthcare provider reasonably believes that the information should not be uploaded because of a serious concern for the health, safety, or well-being of the patient. Now, as I mentioned, this decision should be made in consultation with the patient where possible and should be communicated to the pathology or diagnostic imaging provider, and the reasons should be recorded in the provider's notes on the lab end, for example. So, for example, if that reason is not provided, the pathology lab, for example, is required to document that, and they will probably chase the referring GP for that information before completing. The fourth category is, information cannot be shared due to circumstances outside the reasonable control of the provider, such as unplanned system outage and technical issues and things like that. Now, there's also the extension of time to comply. So the Act does recognise that when the new rules get introduced and the details come into effect regarding penalties, civil penalties, but the Department of Health, Disability and Ageing have made it very clear that there is going to be a grace period to allow these providers to become system conformant. So an extension of time to comply can be granted, or preserved privacy laws apply. So under certain state legislation for the purpose of this. So for this local context, Western New South Wales, Far West New South Wales, we've looked into and investigated with New South Wales Health, Pathology and Radiology, and yes, this legislation applies to both public and private, which means they have to comply to this legislation. And of course, we know that New South Wales Pathology and Radiology, New South Wales Health, they do routinely upload results from their current systems, and some LHDs and others can be a lot more efficient in this. However, due to some technical limitations, so they do have legacy systems, there are known gaps and they're aware of it. All right. Under the statewide single digital patient record, so the infamous SDPR project, they will be implementing a direct interface to My Health Record. And so that's that system conformance where they're trying to be a lot more efficient so that when they complete, they can upload with streamlined processes to make it easier. But it does indicate in certain regions, like for example in Western and Far West, we're not going to be getting single digital patient record in our region until 28, 29. So there would have to be a significant extension request while they transition. Now, this also currently assumes that this will apply to private healthcare providers, GP-generated orders where patient chooses to get their test done, or their only option in certain regional and remote areas, to get their test done at a New South Wales Pathology Radiology Department instead of a private provider that we'll talk about in a second. And on that note, let's just talk about quickly some of the local pathology organisations and those that are conformant. So Douglas Hanly Moir, as of April 2025, are now conformant and actively uploading all results unless patient opts out. And the details are available on their website. At Lavity, same conformant and actively uploading under the same conditions. For Australian clinical labs, however, it does impact certain regions like Cowra, Canowindra, Grenfell, Broken Hill and Madura, but our understanding is that they've always been able to upload to My Health Record, provided you've connected systems. So you've set up for e-order, e-requesting process with them. But the legislation is very clear that they have to upload anyway, whether they're linked through e-request or not. And so it's not clear whether they're going to be applying for an extension or not. So it's something to be aware of, that they may not be uploading by default unless you send through an e-request to those particular labs. As for diagnostic imaging, these two, the most popular and familiar, Loomis Imaging as of December 2025, Dubbo, Mudgee, Dudley Private are certainly conformant. As to other locations, it's not clear on their position, but we'd hope that by February, March this year, they will be, unless they have a technology extension. Same with PRP. They do have their famous My PRP patient portal, so they do have timely access to information for patients. However, the legislation is clear. We're talking about information sharing across provider and teams through the My Health record, so they have to comply with that as well, but not clear as to when that will be in play or if they have a technology extension. So what changes could this reform have on you, clinical teams, GPs in particular? So I think it's just a matter of looking at, do you have clear strategies across the practice, safety nets for patients who cancel appointments for follow-up based on their interpretation of the results, not advised. With test results being shared by default, the number of tests GPs can see that have been ordered by other practitioners will increase. So longer term equals better information flow, which could reduce unnecessary repeat tests, streamline care, and so there's that positive aspect. Also consider a strategy to deal with patients finding out results of tests done in hospital before their follow-up appointment at the hospital. They may need to manage patient requests for explanation of results, such as biopsy reports, post-surgical procedure, etc. And consider a natural assumption here. We are human. If either patient can see the result, then the assumption is my GP must have seen it, right? So robust system of timely review is essential. Impact is the greatest on part-time GPs, GPs on leave, rural GPs, locums, for example, where staffing is short. So I think, it's important to look at the benefits versus risks here and consider this with internal reviews. Yes, there's some risk mitigation, some of those things like potential patient distress in jumping to their own misinterpretation of results, especially if they're highly engaged in their My Health record. Possible increased workload to manage that increased volume, maybe initially, but then outweigh the benefits, better continuity of care, fewer duplications, the longer term benefit. And what I like the most here is it highlights even more the importance of GPs as that conductor at the nucleus, at the center of patient care, and making sure that flow of information is critically happening. So what are some summary key points? I'm going to slowly wrap up now so we can move to the chat and take on any questions if there are any. But as I said, the legislation does not apply to clinicians requesting or ordering tests. There's no need to rush out and say, well, I have to connect to my local lab with electronic ordering. That is not the requirement here. The requirement is on the lab's end. All right, it only applies to them. So pathologists and radiologists performing those clinical tasks. Actively talk to your, if for example you're in those areas where you do use ACL, talk to them. Talk to your local diagnostic imaging provider and ask them, what's your status? Are you uploading by default? They are required to, so it's more of a question of when. Before ordering a pathology or diagnostic test, check, with the My Health record and just see if there are any relevant, more timely results available to consider. And of course, while My Health record is not a complete health record, it can be used to supplement, as we know, other sources of information about a patient. And remember, for a GP clinics, you have the option to save and copy that information into your system as well. But probably I think the biggest thing is a comms plan, right? And we'll get to some of the resources in a second and how the PHN can help in that space. But for some patients who are, especially those who are active users of My Health record, and they'll be, it's your 5% of your population, right, that are going to be onto it, and they're going to be aware of this sort of information. I think review internal workflows for incoming results. Do you have robust workflows for prompt review, for critical result management and follow-up? Patient conversations, nurse-led. Use that opportunity to ask and engage patients proactively in the discussion, especially before you order. And remind patients on website and via other channels about your policy and procedure for managing results and reminders. Manage those expectations, especially patients with high anxiety and concerns around that. You can use that clinical reason regarding safety to exclude it from upload, but have positive conversations around those expectations and how the core clinical team is responsible for reviewing those results and sharing with the patient when the time's right. And then guidance and reassurance. Clear advice about what patients should do once they see the results. And as I said, we've got some links the links to Pathology Test Explains, and there's a couple of good resources there on RACGP website too. And I think, and speaking of the RACG website, there's a lovely article recently from Dr. Hoskin. I just took a quote, which I thought was a nice summary. And that is, faster access to results is not a replacement for clinical interpretation, as we know, but it can create an environment for clearer and more meaningful dialogue with our patients, and especially across teams, the specialists you work with, allied health professionals and the like. Now, as I mentioned, there's a need for this to be resource heavy. We do in the PHN, we have recently printed quite a large volume of these patient consumer flyers, DL flyers, and so hopefully we'll get around to distribution over the next month or two if Lisa and I haven't seen you already. But there is a more detailed document for pathology and diagnostic imaging providers, more detailed, and of course more detailed information for requesters as well, GPs and the like, which are available on the Australian Digital Health Agency website and available on our website as well. As always, when it comes to My Health Record, there's a ton of resources and further information. You've got free online training, e-learning modules. Check out the Digital Health website, register if you haven't already. There's plenty of resources there available to you. And you can always contact directly too. If you're especially in the situation where you do need to register for the first time with the HPIO, you've got the PHN. Lisa and I are here for you, but you can also go directly to the Australian Digital Health Agency, and they have teams to support you in that as well. Before I jump to any questions, I'll just leave on the screen here a reference QR code to our evaluation form for tonight's webinar. We do have a few minutes left for some questions in the chat if there are any, and I'm certainly happy to address what I can for the moment. If we can't address any in the chat this evening, then we'll certainly follow up with a more detailed Q&A at a later date. Lise, over to you. Is there any chat questions at all?
No, there aren't any questions.
That could be seen as a good thing. Hopefully the information is well and truly covered. And apologies if this was a little bit rushed, but there is certainly plenty of information out there, as I said. And the team are here for you to address any of these questions. You're welcome to contact us. And if you require, we are offering practices at the moment. If you feel like your GPs, your clinical teams, your nurses would prefer a more deeper dive lunch and learn session in person, and we're more than happy to come and visit and provide that information service, as we've done to a couple of practices already in the lead up to this.
So Brendan, if you had any tips for anybody, what would be your number one tip to providers ordering tests?
I think the one tip is just what I mentioned already, which is have a review internally with your clinical teams and discuss the change in legislation. Do you think it's going to have an impact? You may look at this and think, actually, you know what? This is not changing anything dramatically. We've been doing and advocating this already. We provide very good communication and manage expectations with our patients. So it's nothing to be worried about. If you look at those benefits versus risks, right? I think the benefits, I tried to imply that slide, I'm not quite sure whether you could tell, but the benefits outweigh significantly in terms of that continuity of care, streamlining of information. I think one little tip I would like to see, if you're seeing or you're constantly being chased by external team care members, specialists for results or things like that, advocate for My Health Record. Advocate for, do you have access? It's right there for your viewing. And if the specialists aren't on My Health Record, then tell them to contact us. And we'll try and support them in getting registered. But I think the message is clear that as this reform grows over time, and remember, phase one is just pathology and diagnostic imaging. We're going to see other healthcare providers that are going to be required by default to upload. It's going to come your way at some point. The question is when and what the impact's going to be. And so the sooner you understand and appreciate the real-time sharing of information is critically important for care delivery as we move forward, and getting on board and supporting and working with those benefits can certainly help in delivering care. Yeah. All right, I think that brings us to a close if there's no other questions. I promised to deliver within half an hour. Look at that, right on 7. So hopefully it's worked out for everyone. I really appreciate for those who could tune in for tonight. As I said, this will be made available as a video link in due course, hopefully by next week, and we'll share that information with everyone if you need to catch up. So thank you, everyone. Enjoy the rest of your evening, and we'll speak later.